The number one water trick. Everyone over 60 should know for better circulation. This is the water drinking technique doctors have used for more than 2 decades to treat sudden, dangerous blood pressure drops in older adults. And it's backed by research going back to the year 2000. It takes about 60 seconds to do, and by the end of this video, you'll know exactly how much water to drink, when to drink it, and why it works on your nervous system rather than your blood itself. We're also going to cover what this trick can't do, because there's a lot of misinformation about water and circulation out there, including one statistic you've probably heard that turns out to have no scientific backing at all. With that in mind, here's the problem this trick actually solves. The problem: why blood pressure drops as we age. If you're over 60, there's a good chance you've experienced this. You stand up from a chair or you get out of bed, and for a few seconds you feel lightheaded, maybe even dizzy enough to grab onto something. Sometimes it happens after a meal instead, where you eat lunch and 20 minutes later you feel foggy, weak, or unsteady on your feet. Both of these are real documented conditions with names. Doctors call the first one orthostatic hypotension, a drop in blood pressure when you change position, especially standing up. And the second one is postprandial hypotension, a drop in blood pressure after eating. Both show up frequently in older adults, and both can lead to dizziness, falls, and fainting. That matters because falls rank among the most serious health risks facing people over 60, and an unstable drop in blood pressure is one of the underlying causes behind them. So for more than 20 years, researchers have been chasing a specific question. Is there a fast, safe, non-drug way to counteract this? What they found involves a glass of water, though not in the way most people assume. The discovery: water and blood pressure. Most of us think about water and blood pressure in one simple way. Drink more water, your blood has more fluid in it, and blood pressure goes up. That's not actually what's happening here, and understanding the real mechanism is the key to understanding why this trick works. Dr. Jens Jordan, working at Vanderbilt University at the time, published a study in the journal Circulation back in the year 2000. The title of the paper asked a direct question: the pressor response to water drinking in humans a sympathetic reflex? In plain language, does drinking water raise blood pressure by triggering your nervous system rather than by simply adding fluid volume to your blood? His research, and the research that followed it, answered yes. Scientists now call this effect the osmopressor response, and you'll sometimes see it labeled the water pressure response instead. Here's what the research shows happens inside your body. When you drink a glass of plain water, your blood pressure rises, and it's not because your blood volume suddenly increased, since that happens far too slowly to explain it. The rise happens because the water is what's called hypoosmotic, meaning it's more dilute than your blood, and your body appears to detect that dilution and respond by activating your sympathetic nervous system, the same system behind your fight or flight response. That activation is what pushes your blood pressure up. Researchers have even tracked down a possible cellular mechanism behind this. Studies in mice point to a receptor called TRPV4 as a likely osmosensor, a cell structure that detects changes in fluid concentration and sets off this nervous system response. And that research appeared in the journal Hypertension in 2010. To be honest about the limits here, scientists still don't have the full picture of exactly which cells in the human body are doing this sensing, or the complete chain of events that follows. What they do have is an effect that's been reproduced across many studies over more than 2 decades. Water triggering a measurable blood pressure rise through the nervous system. The timing and the amount. How much water are we talking about, and how fast does it work? This is where the research gets specific. 16 ounces, that's roughly what shows up again and again across these studies. A full, tall glass of water measuring about 480 to 500 milliliters. Timing has been measured just as closely. In patients studied by Dr. Jordan's research group, blood pressure began rising within 5 minutes of drinking the water, reached its highest point at 20 to 30 minutes, and stayed elevated for more than 60 minutes after that. Multiple papers from this research group describe that same timeline, including a major review of the field published in 2011 in the American Journal of Physiology. What you get, in other words, is a fast, measurable, hour-long window where your blood pressure sits higher simply because you drank a glass of water at the right moment. Who benefits the most? Here's where we need to get precise, because this is exactly where a lot of health content online overstates the science. The size of this effect isn't the same for everyone. People with a specific type of nervous system disorder called autonomic failure, a condition where the nervous system fails to properly regulate blood pressure and which shows up in conditions like Parkinson's disease and multiple system atrophy, get a large clinically meaningful response from this trick. Researchers describe it as producing a large acute pressor response, and it's been used therapeutically with these patients for years. Healthy people without a diagnosed nervous system condition get the same response, just smaller. The research calls it modest or subtle, a real measurable rise in blood pressure and heart rate activity, but nowhere near as dramatic as what shows up in patients with autonomic disorders. There's also solid evidence for a related condition called POTS, or postural orthostatic tachycardia syndrome, where the heart races excessively upon standing. A study referenced in Dr. Jordan's 2002 paper in the American Journal of Medicine found that patients with orthostatic intolerance had a heart rate of 123 beats per minute on standing before drinking water. That number dropped to 108 beats per minute after they drank it, a statistically significant reduction. It's worth sitting with that distinction for a moment because it explains why this trick shows up in medical literature as a treatment tool rather than a general wellness tip. A patient whose nervous system has lost the ability to properly regulate blood pressure gets real, measurable help from a glass of water, work their own body can no longer do reliably on its own. A healthy person whose nervous system is functioning normally gets a smaller nudge from that same glass of water, applied to a system that's already working. Both effects are real. They're just not the same size. So let's be clear about what this trick actually is. A well-documented technique for improving blood pressure stability around the specific moments when it tends to drop, standing up and eating a meal. It is not a general circulation booster that transforms your cardiovascular system, and the research doesn't support that broader claim, so we're not going to make it here. The second use, water before meals. There's a second closely related application worth covering, and it's directly relevant if you deal with post-meal dizziness. In that same 2002 paper, Dr. Jordan's group tested what happened when patients drank about 480 milliliters of water just before eating a meal, compared with eating the meal alone. Meals can cause a real drop in blood pressure, especially in older or frail adults, and that's the postprandial hypotension we mentioned earlier. Water taken before the meal substantially reduced that hypotensive effect, which means drinking a full glass shortly before eating helped prevent the blood pressure dip that often follows. That detail has carried into more recent clinical guidance too. A 2022 review published in the journal Autonomic Neuroscience lists water drinking as one of several non-drug tools, alongside compression stockings, adjusting salt intake, and changing positions slowly, used to help manage orthostatic and postprandial blood pressure drops in patients. How strong is this evidence really? Let's pause and look at how solid this research actually is, because that matters more than a good story. This isn't one small study standing alone. Researchers have studied and confirmed the osmopressor response across multiple decades, starting with Dr. Jordan's original 2000 paper in Circulation, continuing through mechanism studies in 2003 and 2005, a major consolidating review in 2011, and most recently, a formal systematic review and meta-analysis published in 2023 in the Journal of the American Heart Association, led by researcher Dr. Satish Raj. A systematic review and meta-analysis combines and statistically analyzes the results of many previous studies, which makes it one of the strongest forms of evidence in medical research, and its existence tells you this effect has been examined rigorously, not just observed once and repeated informally. That covers the strength of the evidence for the core mechanism. Now, for where the evidence gets weaker or points in a direction you might not expect. Where the evidence gets more complicated, does drinking extra water beyond what your body already needs actually make your blood measurably thinner or lower cardiovascular risk in someone who's already properly hydrated? A controlled study published in 2007 in the British Journal of Nutrition tested exactly that question and found no significant effect of increased water intake on blood viscosity or cardiovascular risk factors in people who were already normally hydrated. The likely explanation is that your body's own regulatory systems compensate fast. So if you drink more than you need, your kidneys simply excrete the extra, and any blood viscosity change doesn't stick around. One older study from 1991 found something more specific. Elderly subjects given an electrolyte drink at midnight showed a smaller rise in blood viscosity when measured at 4 and 8 in the morning compared with subjects who drank nothing. That detail is worth knowing, but it comes from a small dated study, so treat it as a limited data point rather than a proven strategy. Put together, what this tells us is that the benefit of water isn't simply more water, thinner blood, better circulation. The real, well-supported mechanism is the nervous system reflex described earlier, the osmopressor response tied specifically to blood pressure stability at key moments rather than a general thinning of the blood. Dehydration and stroke, what the data actually shows now. For the other side of this, the risks of not drinking enough water, and this is where some of the most attention-grabbing claims live, so we need to be careful. Basic physiology already establishes that dehydration increases blood viscosity through a process called hemoconcentration, meaning your blood becomes more concentrated when you have less fluid in your system. That part isn't controversial. It's accepted physiology. A large recent study adds more weight to the picture. Researchers analyzed a database of roughly 3 million patient records across 55 U.S. healthcare organizations, led by researcher Irene Hamrick, and published their findings in 2025 in the Journal of Stroke and Cerebrovascular Diseases. What they found was a strong statistical association between dehydration and ischemic stroke, along with a similar association within a subgroup of patients with diabetes. Here's the critical caveat straight from the researchers themselves. Association isn't proof of cause and effect. The study's own authors state plainly that future research needs to determine whether increasing hydration actually leads to a decrease in stroke risk. So while the link between dehydration and stroke risk shows up clearly in this data, we can't yet say that drinking more water directly prevents strokes. That claim goes beyond what the current evidence supports, and we're not going to make it here either. One more figure is worth mentioning, with an important caveat attached. About half of elderly Medicare beneficiaries hospitalized with a dehydration diagnosis died within a year of that hospitalization, according to the data. That number sounds alarming on its own, but context matters. These were patients already sick enough to be hospitalized, and dehydration in that setting is often a marker of serious underlying illness rather than an isolated independent cause of death. Take it as a reason to treat dehydration seriously in frail, hospitalized older adults, not as evidence that dehydration alone carries that same risk for an otherwise healthy person. How common is dehydration in people over 60? You may have heard the claim that 75% of Americans are chronically dehydrated. Let's address that directly. The claim is false, or at minimum, entirely unsupported. The National Institutes of Health's own published medical reference material states it outright. Although mainstream media frequently claims that 75% of Americans are chronically dehydrated, no scientific evidence in the medical literature supports this assertion. That number isn't accurate, and it shouldn't keep getting repeated. So what does the real research show? The actual numbers run more modest, and they shift depending on how researchers measure dehydration and which population they're studying, between 17% and 28%. That's the range NIH published data reports for dehydration prevalence among older adults in the United States. A more rigorous 2023 systematic review and meta-analysis using the gold standard measurement method of directly measuring blood osmolality found an overall point prevalence of about 24% among non-hospitalized older adults. Breaking that number down further, 34% of older adults in long-term care settings showed signs of dehydration compared with 19% of older adults living in the community. That same review turned up something else worth knowing. No statistically significant difference in dehydration risk based on age within the older adult population, sex, diabetes status, or cognitive function. Simply being older within this group doesn't automatically raise your risk on its own. Factors like where you live and your mobility appear to matter more. One more relevant figure rounds this out. Roughly 25 to 33% of adults in the United States and Europe consume less than 1.5 liters of fluid per day, and research indicates that people over 50 are significantly less likely to meet recommended fluid intake levels than younger adults. Why dehydration risk changes with age? There's a specific physiological reason older adults run a higher risk of underhydration, and it's worth explaining because it's not simply about forgetting to drink water. Thirst itself blunts with age, a well documented phenomenon researchers sometimes describe as reduced thirst drive in older adults. Your body may need fluid, but the internal signal telling you to drink isn't as strong as it used to be. There's a second factor working alongside that one. Healthy older individuals lose some ability to concentrate their urine compared with younger people. In practical terms, that means the body needs a relatively higher, more consistent fluid intake just to maintain the same hydration status, since it can't conserve water as efficiently through the kidneys the way a younger body can. Put a weaker thirst signal together with a reduced ability to conserve water internally, and you can see why dehydration shows up more often in this age group, even without any single dramatic cause behind it. How much water should you actually be drinking? Let's get concrete here. The official guideline in the United States comes from the National Academies of Sciences, Engineering, and Medicine, published in a formal report on dietary reference intakes. 3.7 liters a day for men, 2.7 liters a day for women. That's the National Academy's recommendation for adequate daily total water intake, counting water from food as well as beverages, or in more familiar terms, about 15.5 cups for men and 11.5 cups for women. Roughly 80% of that typically comes from drinking water and beverages, including caffeinated ones, and about 20% comes from the water naturally contained in food. That's higher than the commonly repeated 8 glasses a day rule, which doesn't have a strong scientific origin and falls short of the National Academy's figure. The same report also makes an important, more moderate point, though. It states that the vast majority of healthy people adequately meet their hydration needs simply by letting thirst guide them. That's a more conservative stance than a lot of hydration content online suggests, and it's not telling people to force down large amounts of water beyond what they actually need. An important caution: more water isn't always better. Before we get to the practical takeaway, there's a safety point that deserves real attention, especially for an audience over 60. Drinking more water than your body can process, relative to your sodium levels, can lead to a condition called hyponatremia, sometimes referred to as water intoxication, and in severe cases, it can turn dangerous. Historically, this has shown up most often in endurance athletes, but the underlying physiological risk applies more broadly to anyone taking in significantly more fluid than their body can regulate. Older adults face particular relevance here because certain common conditions and medications change how the body should handle fluid. Doctors frequently advise people taking diuretics or those with kidney disease or heart failure to manage fluid intake carefully, and in some of those cases, the correct medical guidance actually runs the opposite direction: restrict fluids rather than increase them. So here's the honest, necessary caveat for this entire video. Everything described here comes from general research findings, not personalized medical advice. If you have a heart condition, kidney disease, or take medication that affects fluid balance, the right amount and timing of water for you should come from your doctor, not from a general guideline like the ones in this video. This is also a good moment to repeat something mentioned earlier. The National Academy's own guidance says most healthy people meet their hydration needs simply by following their thirst. The technique in this video isn't an instruction to drink large amounts of water throughout the day beyond what feels normal for you. It's a specific, targeted action at specific moments, and that distinction matters both for safety and for accuracy. Putting it into practice. With all that context in place, here's what the research actually supports as a specific, usable technique. The evidence points to drinking approximately 480 to 500 milliliters of plain water, about 16 ounces, a full glass, fairly quickly, at 2 key moments. The first moment comes before standing up after sitting or lying down for a while, particularly if you know from experience that you tend to feel lightheaded or dizzy in that transition. Given the timeline from the research, with effects beginning around 5 minutes, peaking at 20 to 30 minutes, and lasting over an hour, drinking that glass of water a few minutes before you plan to get up gives your body a window where blood pressure sits more stable. The second moment comes shortly before a meal, particularly if you've noticed the fogginess, weakness, or unsteadiness after eating that we described earlier as postprandial hypotension. Dr. Jordan's group specifically showed that water taken before a meal reduced the blood pressure drop that followed it. What you end up with is a low cost, low risk, evidence supported habit for the specific problem it targets: blood pressure instability around standing up and eating. It is not a universal fix for circulation as a whole, and the research doesn't support treating it as one. Bringing it together. Let's tie this back to where we started. This video set out to explain the water drinking technique doctors have used for decades to help manage sudden blood pressure drops in older adults. And now you know exactly what that technique is, why it works, and its real limits. It's called the osmopressor response, first documented by Dr. Jens Jordan and colleagues in the year 2000 and confirmed through more than 2 decades of follow-up research, including a formal systematic review published in 2023. The mechanism runs through your nervous system, triggered by the dilution of the water you drink, not simply extra fluid volume in your bloodstream. The practical version of the trick comes down to a full glass of water, about 480 to 500 milliliters, taken a few minutes before standing up or before a meal, particularly if you're someone prone to dizziness in those moments. We also covered what the science doesn't support: the myth that 3/4 of Americans are chronically dehydrated, the idea that extra water measurably thins the blood in people who are already well hydrated, and the claim that hydration has been proven to prevent stroke, rather than simply being associated with it in the data available so far. What the real research supports turns out more modest and more useful than the exaggerated version. A genuine, well-documented reflex in your body that you can use at the right moments with a simple glass of water, as long as you understand both what it can do and what it can't.